Hello everybody, today we will talk about the first pharmacovigilance training. We will talk about why do we need to report, what is the meaning of adverse event, and we will give some examples on special case scenarios. What is the minimum information do we need to report, who is responsible for reporting, and to whom we can report. Why do we need to report? Firstly, we are obliged by the law and regulations of the Ministry of Health to report. Secondly, we are responsible for the safety of our patients and their safety data. Thirdly, we shall be aware to report within a time frame, so Ministry of Health and the management can take action. Fourthly, reporting patient safety data shows company integrity. It means when we report safety data, it means the management know everything about the company. The fifth point, reporting safety data helps protect company business reputation. Because when we report safety data, it means we have transparency, because we are transparent in everything. What is an adverse event? Adverse event is an unfavorable and unintended sign, like abnormal laboratory finding, severe symptom, temporary disease, associated with the use of medicinal product, cosmetic product, or medicinal device, whether or not related to the medicinal product. If it's related to the medicinal product, it's called adverse drug reaction. Examples of special case scenarios. First case is pregnancy and lactation. If a female patient comes to you and she told you that she took a medicinal product and later she was found to be pregnant, then she stopped the medicine. In this case, you have to report. Another female patient came to you and she told you that she received a medicinal product while breastfeeding. Also, you have to report this case. Second case is withdrawal syndrome. If a patient came to you and told you that he started experiencing diarrhea and vomiting immediately after stopping the use of medicinal product, you have to report. Third case is rebound effect. If a patient came to you and he told you that he has attention deficit hyperactivity disorder treatment with a medicinal product, after stopping his medicinal product, attention deficit hyperactivity disorder symptoms aggregates, you have to report. The fourth case is lack of efficacy. You can see in social media or local literatures that a patient mentioned that his blood pressure didn't fall as expected after the treatment was started. In this case, you have to report also. The fifth case is disease progression. If a diabetic patient case was progressed after receiving the maximum dose of insulin, you have to report this case also. Another examples of special case scenarios. Unexpected beneficial effect. If a patient came to you and he told you he started taking antihypertensive product and later he noted that his or her loss stopped. In this case, you have to report. Medication error associated with adverse reaction. If a patient took his mom pills by accident and he experienced nausea for a few hours, you have to report also this case. Medication error without harm. A patient received a product after the expiration date and he didn't have any problem. You have to report. Intercepted medication errors. A wrongly prepared medicine was not administered to the patient because the error was noticed by the staff. In this case also you have to report because this problem may be happened. Potential medication error. If a pharmacist noticed that the name of the design of two products are very similar and may lead to an error, he have to report. More examples of special case scenarios. Transmission of infection. If a patient came to you and he told you that he developed infection after taking immunosuppressant agent, you shall report. Drug dependence or abuse. If a patient had medication for depression and he couldn't stop it because of its sedative effect, you have to report. Or a patient used a treatment with a high dose for an euphoric effect, you have to report. Off-label use. A chronic renal failure medication used for treatment of anemia, you have to report, but I think it should be reported by doctors or nurses. Counterfeit and falsified product. A patient told you that he bought medicine with different shape, color, size, or packaged in a poor quality material. In this case, you have to report. Or a patient noticed that his medicine had no ingredient, or the ingredient was mixed with another material. You should report also this case. What is the minimum information do you need to report? First point is the product. When you report, you shall report the name of the product, active ingredient, and the batch number. And the batch number is the most important point. Second point is the description or the narration of the adverse event or the special case scenario. Third point is the reporter. The reporter initials and their contact details. Fourth number is the patient gender, age group, or year of birth. And also you can report his or her initials. Who is responsible for reporting? Every employee for IMC shall report all adverse events and special case scenarios to QBBV. For reports received on Thursday, don't wait until Sunday. You shall report it immediately. Day 0, when you first know about the adverse event or the special case scenario. Always put the date on the report. The 24-hour is valid for both initial report and follow-up reports. Thank you very much. And if you have any questions or you want to report me any data, you can call me or you send me an email. I am available 24/7.